In the December of 2023, we all had a bit of a scare because COVID struck again. There was always a worry whether it would be a very serious episode, which had happened a couple of years ago. But fortunately, the serotype of COVID which attacked us belonged to the Omicron batch and its lineages. Fortunately, they caused only a mild infection and there were very few hospitalizations. But in spite of that, those who were hospitalized who had severe disease belong to the group of patients who are either very elderly over the age of 75 or those with compromised immune systems. People who are on steroids, people who had transplantations, all these conditions predisposed to serious COVID. So, how is it likely to pan out in the future? COVID is, like the influenza virus, a very rapidly evolving virus with regard to mutation. Frequent mutations can lead to sometimes a strain which can cause severe infection, just like the swine flu, the H1N1, which came out in 2009. There is a possibility in the coming years, maybe after 3 years or maybe after 10 years, we can get a severe strain which can cause a high mortality. But till then, what are we to do? How do we protect ourselves? Of course, the established methods of masking and social distancing is still the most evidence-based intervention to prevent spread of COVID. But vaccinations, even though they do not prevent infections, can definitely prevent serious consequences of the infections. What are the current guidelines for vaccination? One thing is very clear. There is no role for going back to the original Wuhan strain, the monovalent vaccine which was available in the beginning. What we had like Covaxin and Covishield are no longer acceptable as vaccination during the current Omicron surge. So we either need to take a bivalent vaccine like the one which is available in the West, the Moderna or the Pfizer, or in India we have a monovalent but Omicron strain, an mRNA vaccine which is currently available, which has to be used. Number two, those who have had at least one dose in the past and presumably have suffered from COVID are reasonably protected. But if you have a person who has had only one dose in the past, a definite second dose now with the currently available Omicron mRNA vaccine is recommended. In fact, the CDC has recommended that those who are immunocompetent need only 2 doses as the primary course, but those who are immunocompromised, as I said earlier, those who are on steroids, those who are having comorbidities, or people who have had their transplantation definitely require 3 shots as the primary vaccine course. A booster is currently recommended for those above the age of 60, definitely above the age of 75, and this has to be taken at least 6 months to 1 year after the primary course is over. And I repeat, the booster currently should be that which contains the Omicron strain only. Are there any other subpopulations of patients who also require booster? Apart from the elderly, people who are immunocompromised, people who are pregnant, and healthcare workers. These are the other groups of persons who need or who would probably benefit from a booster.